We've learned about the famous programs from the state's perspective. Now we welcome Dr. Bill Moskowitz, Interim Chairman of the Department of Pediatrics at Virginia Commonwealth University. Dr. Moskowitz has been a pediatrician and pediatric cardiologist for 24 years. In addition, he's the father of 4 and has 3 grandchildren. Welcome, Dr. Moskowitz.
Thanks, Deb. Good to be here.
We're delighted to have you with us today. So tell me, does having health insurance really affect the health of children?
Well, as you know, in this country, more than 9 million children are without health insurance. That's 1 in 8 children. And health insurance makes a big difference for kids. Children with health insurance get regular healthy checkups. Problems are detected early. They get intervened on very early, either early detection, early treatment. They get their vision checked, their hearing checked. They get their immunizations. When problems are detected, they get the appropriate medication, and they have follow-up with their regular pediatrician or healthcare provider so that they are prepared to go forward in life as healthy as possible. Developmental screenings take place so that if a child is not walking early or at the appropriate time, speaking or communicating, interventions for evaluations take place, and then appropriate therapies are prescribed. Children with health insurance have a greater likelihood of getting all these screenings, seeing a pediatrician, or more compliant with medications that are prescribed because they have follow-up. Individuals who don't have health insurance are less likely to get these screenings and may therefore have health problems that are undetected or possibly have developmental delays, hearing problems, or visual problems that may impede their ability to learn in school. So the early detection and the frequent visits appropriate for age are what health insurance provides access to.
So that's quite a lot of things that a child with health insurance has that those without health insurance don't have as ready access to.
That's exactly correct. Studies have shown that the uninsured child is more than 5 times less likely to get appropriate health screenings, have unmet health needs, visual screenings, dental checkups than the insured. And as an example, if you look at problems with asthma, children with asthma who don't have health insurance are 3 times as likely of having exacerbations and flares of their asthma than children who are insured because they have regular checkups, they are on medications, they are followed in a medical home, and pediatricians who know them and can communicate readily because of the access with the family and the child to be sure that they're taking the medications, and at the earliest sign of a problem they get seen and interventions are put in place so that the child does not progress to requiring hospitalization.
I've read that health insurance also really has a direct relationship with how well a child does in school.
You have to be able to be in school, to be able to hear the teacher, to see the chalkboard, to be able to be active in physical education. And if you have been delayed because you have hearing problems, if you have visual problems that have not been detected, your performance in school is going to be adversely affected.
Often children without health insurance don't seek care right away when they become sick. What are the consequences of that? And have you seen any instances where that kind of thing occurs?
Sure. Let's give a simple example of middle ear infections. It's called otitis media. It's very common. It's the most common infection that children have. 3 out of 4 children by age 3 have had an ear infection. It's due to the fact that fluid can build up in ears and then they get secondarily infected. Sometimes the child has a fever or ear pain and we'll bring that to the attention of the parents, sometimes not. But if left untreated, and simple treatment's antibiotics, by seeing a physician, taking antibiotics for 10 days, it rids the ear of the infection. But if it's untreated, it can lead to damage to the middle ear, can lead to perforation of the eardrum, scarring of the eardrum, or if the fluid builds up for long periods of time, it can damage the ability to hear. So long term, if it's not addressed early, can lead to chronic inability to hear, again, ability to learn and to communicate in the developing child. A more poignant story was a year ago in, I think, Prince George area. A 12-year-old had a toothache, and the family did not have health coverage, and this protracted course led to a bloodstream infection from an abscess tooth, and subsequently, after months, multiple procedures, $250,000 health care, the child unfortunately died, whereas an $80 extraction would have taken care of this problem. So that access and longevity of a prom does have an impact.
Well, I remember reading about that, and he wouldn't even have needed to have an extraction if he had access to dental care and could have just had regular checkups and his cavities filled.
Exactly right.
That was a horrible, extreme example of what can happen when children don't have access to health care and dental care. We hear a lot of talk about medical homes these days. Just briefly, can you tell us what is a medical home?
Sure. The American Academy of Pediatrics introduced the term medical home back in '67, but expanded in 2002 to talk about a relationship that the patient and child has with a primary care provider, physician, who centers the care around the family, around the child. It is coordinated, it is continuous care, it is access very easily to that relationship where the physician knows the patient, interacts on a well-child system, as well as acute illness and chronic illnesses, coordinating care with subspecialists as necessary. But it's a home that the family, their needs, the child's needs are all incorporated, and allows for continuity of care.
And let me just ask you one last question, Bill. If you had one thing that you wanted parents to know about the importance of health insurance for their children, what would it be?
I think from access to basic health care services as well as prevention care, having insurance allows you accessibility to all the needs that your child will require during growth and development that will prepare them to be in good health and to perform up to whatever expectations there are in school and in life. Some things that you can't prevent or you can prevent but fail to do will have lifelong impact in learning and ability to be good citizens and productive, so that the little things early in front during development make a big difference. And so during economic difficult times, people have to balance priorities, and I think ensuring the best for your child's future by having access to health care, by having a famous type program and insurance, is a good investment for the child's future.
Thank you so much, Bill, for being with us today and talking about how important health insurance is for our children.
Thank you.
From a medical perspective, it is clear. Health insurance makes a significant difference in getting children off to a healthy start and keeping them that way. Please join me in greeting Julia Melendez from Newport News.